I have no slides. So first I want to say my office collaborates enthusiastically and often with ASPE, and it's typical of ASPE to step back and look at the big picture and create a venue for thinking about big questions. And this has been a terrific day, and I've learned a lot so far. So I really appreciate having that opportunity and all of the speakers up until now. So my agency, the Administration for Children and Family, is responsible for the Head Start program, the TANF welfare program, child support enforcement, child care subsidies, child protective services, community services block grant, the low-income home energy assistance program, refugee resettlement, and a host of other programs, about 60 in all. Many of them lack any substantial research or evaluation resources and couldn't really participate in a discussion about evidence-based practice. That's sort of a topic for another day, but I did want to mention it. In most cases, ACF, like many federal agencies, does not directly provide or administer services. Rather, we make grants to states or tribes or local organizations to provide services. Or in some cases, we make grants to states and they turn around and make subgrants to organizations to provide services. So our influence on the actual provision of services is typically indirect. I want to talk about how the federal government can support, encourage, or require or otherwise influence the effective, widespread use of evidence-based practices. And it may be unnecessary for anybody else in the room, but I think it's worth reminding ourselves that requiring is not necessarily more influential than supporting or encouraging. And certainly in the federal government, it's easy to think that a rule is the right tool for accomplishing any end. So I was asked to give a case study. This is not exactly a case study, except in the sense that I'm going to talk about what it's like to be me. Or that was one possible title for my talk. Another was Be Careful What You Wish For, because this evidence-based practice stuff is not for the faint of heart. A third possible title is How's the View from Here, which is just a version of what's it like, what does this all look like from the federal level. And you know, on a clear day when it's not obscured by bureaucratic clouds, the view is really magnificent. But you might need binoculars because the actual people actually providing services to actual children and youth are very far away and often many levels removed. So this takes me back to my point that our influence is often very indirect. Nevertheless, I believe the federal government can have a tremendous influence on the use of evidence-based practices, including scale-up. There are many potential avenues for federal influence, and I'd like to talk about some of these. Some of these are mostly hypothetical, at least in my direct experience. For some I'm aware of and have been involved in concrete examples, and I'll mention those. So we can require the use of evidence-based practices, and you've already heard about the home visiting program and the teen pregnancy prevention program. Congress chose that route. Congress reserved the majority of funds in each of those programs for evidence-based practices. There are different versions of requiring evidence-based practices. Excuse me, in teen pregnancy and home visiting, HHS set criteria for what is an evidence-based practice, including standards for what types of studies would count and standards for what types of findings would count for a model to be considered an evidence-based practice. HHS contracted for reviews of the research evidence and identified specific program models that grantees could use. 7 in the case of home visiting, 28 in the case of teen pregnancy prevention. An alternative model or approach for requiring the use of evidence-based practices relies on the competitive grant process. So examples include the small discretionary evidence-based home visiting program that preceded the current national home visiting program and the Department of Education's I-3 program. In this model or approach, the government would need to define criteria for evidence-based practices in a grant announcement, and then allocate points out of 100 that would go, that would be provided on the basis of the grantee's application showing the use of evidence-based practice. And the points that are assigned come out of a limited pot of 100 when there are a lot of other things that you care about in the application. So the use of evidence-based practices might not be the determinative determinative factor in who wins the application. You hope that the applicants respond appropriately. You hope that, in fact, there are proposals that are strong in the use of evidence-based practices, and then you have to recruit and train and rely on grant reviewers to score those applications appropriately. So there are pros and cons to both of these approaches. They're quite different, and it's interesting that both are happening at present, and in a few years we'll know more about how they worked out. In addition to requiring the use of evidence-based practices to receive federal grants, the federal government, of course, can sponsor research and evaluation. We can sponsor efficacy trials, although Karen says we should skip those.
No.
We can sponsor effectiveness studies, implementation studies. We can sponsor what works for whom under what conditions studies that you can think of as inside the black box studies, or I think of them as maybe combining implementation and impact. We can sponsor evaluations of adaptations, although it's been pointed out that sometimes we choose not to prioritize that type of study. We can, although I think perhaps we haven't much, sponsored research on systems and organizational factors. We can and do sponsor registries and clearinghouses and literature reviews to catalog evidence bases. And something else that we can do and do for research that we sponsor through contracts is to publish all of the findings, whether they are favorable, null, or unfavorable. And I think that's really an important hallmark of federally sponsored research, because we know not everybody does that, and it can be misleading. We can use the bully pulpit. We can encourage cultural shifts. We can foster intellectual exchanges such as this meeting. We can provide opportunities for exchange between opinion leaders on the research side and the practice side. We can provide technical assistance, and we do. We can provide TA targeted to specific grantees and organizations, or broader efforts such as clearinghouses or the development of materials that are available broadly. I could say more about TA, but in the interest of time, I'll go on. We can try to define and set standards and expectations for fidelity, for adaptation, for generalizability, what counts as an appropriate service population, and for fit. For example, we can require grantees to demonstrate community involvement in the selection of an evidence-based practice. We can support or allow the use of federal grant funds for infrastructure, and that is a hallmark of the home visiting program. Indeed, it's written into the legislation, as Audrey mentioned this morning. We can support or allow time for startup, and Amy mentioned that as a feature of the teen pregnancy prevention program. We can do that by saying so, that we can tell grantees that we expect that there will be a startup period. We can postpone measurement of outcomes or of implementation or evaluation efforts until a program has had a chance to get up and going. Or I think even better, we can put measurement efforts and evaluation efforts in place early on so that we can learn from those startup phases. There's important information in those startup phases about what aspects of implementation are critical to impacts, as well as simply how implementation proceeds. We can sponsor and support intermediaries, and there are a number of examples of this, not all specifically tied to evidence-based practices, but the Compassion Capital Fund under the prior administration is an example of an intermediary initiative. The Supporting Communities Fund under the Recovery and Reinvestment Act, the Social Innovation Fund, those are all examples of the federal government supporting intermediaries to help on-the-ground practitioners. We can try to design accountability mechanisms to support use of evidence-based practices, and that's something that's been mentioned earlier today. So, for example, we can require grantees to conduct evaluations. We can sponsor independent evaluations of grantee operations. We can incorporate measures of the use of evidence-based practices into performance measurement, and that those could be measures of the use of specific EBPs or generic measures of the use of EBPs. We can put monitoring in place, monitoring of implementation, monitoring of outcomes. Federal monitoring, I think it's safe to say, is generally unlikely to be intensive because we don't typically have the staff or resources to provide intensive monitoring, and so the specific elements that we focus on in monitoring, it's important that we prioritize carefully. We can set expectations in various fields for, or standards or requirements or certification standards for staff training. And we can support networking and peer learning through sponsoring meetings or virtual exchanges of information. So, we're big. Federal government is big. We have money, not as much as, well, I don't know, not as much as we think, apparently, and there'll be less in the future. But so we have the potential to be very influential, but we are pretty distant from actual practice. So we have to think carefully about really the logic chain from some decision that we make and something that we write in a grant announcement to the ultimate outcomes that we're seeking to accomplish. I want to close with just one comment that I don't think is depressing, but it might sound that way, and that is that the reach and scope of rigorous evidence will always be small relative to the universe of social problems that need to be addressed. To me, that makes it even more important. To me, that's motivating, that it's very important that we aim to continue creating knowledge and increase the reach of evidence. But I don't think, we're not at a point where, say, we're 80, 90% of the way there, and if we just push a little harder, we'll have it. We'll have all of the evidence, and we'll know what to do. Evidence will always be a small part of the information available for decision making and will have to be incorporated with other sources of information that people rely on at every level, at the federal level, at state and local government level, in the classroom or in a service setting. It'll have to be combined with values, with community preferences, political pressures and public opinion, tradition and professional norms, considerations of capacity and cost. Anecdote will always be with us, with experience and judgment and expert opinion. And I think our conversation today is a good example of the way that evidence will always be only a partial source of information, and it's great to be among so many people whose expert opinion I have and will continue to seek out. Thank you.